Hello and welcome to RIVE, Reflections in Veterinary Education. Super excited. I'm going to hand it over to Catherine for this episode as we've got a special guest. Catherine, you want to take it over?
Yeah, thanks. We're excited to have Dr. Cindy Dixon with us today. She has been a lifelong educator in her career. She did a little bit of practice, but then discovered pretty quickly that education was the way she wanted to go. So we're excited to have you here, Cindy. We'd like to welcome you. Um, I guess we'll just start off by asking you to tell us a little bit about yourself and how you landed in the job that you're in.
Thank you very much. It's a lot of fun to be here and to hear familiar voices and get to catch up with some of my amazing colleagues. So thank you for inviting me. As you said, I'm a veterinarian, but pretty quickly transitioned to teaching. Did some practice in the earlier years of my academic path, but after that, the last few years, I've just been either teaching or in academic roles, and haven't had a clinical role in about 3 or 4 years now. I was a graduate of Auburn University and did an equine internship following my graduation from vet school, and then tried to find the best of both worlds in mixed animal practice, and think that I found some fabulous things and some things that compounded some of the issues that I saw during my equine internship. We were on call all the time. We didn't split call with the other small animal practices. Had some great mentors and friends, but didn't see a sustainable way to continue doing what I was doing and was open for a change. So thought at that time, maybe I'll see if I can teach a night class at the community college and if I like teaching. So I submitted an application just to be an adjunct, teach one class a week in the biology department. Got a phone call from their HR department and asked if I wanted to roll my application over into their full-time tenure track job list, and was taken aback, but said, well, I guess so. Why not? I'll give it a shot. And that's how it started. So for some reason, they hired me, having never taught in front of a classroom at all, to teach full time across several different fields in biology. Trial by fire is an understatement, but it was a lot of fun. And my department was fabulous. I'll probably have to send them the link to this recording later. But they were fabulous, and I had a great mentor, department chair, who tried to put me in courses that she thought would be the most reasonable for me my first semester. And she put me in things like basic biology 1 and 2, a 2-semester series, and I had to teach about plants and fungi and protists and things I had not considered much in quite some time. But I think I realized I was meant to be in education the first semester, because I was so concerned about teaching about plants and photosynthesis and plant anatomy, all of this stuff that I was uncomfortable with. So I really dove in and tried to create a great presentation, pulled in lots of resources and videos, and gave my presentation and went through the rest of the class and got my course evals back. And one of the comments was, man, period, she must really love plants.
I love it.
It was literally a here's your sign moment.
Yeah.
That's awesome.
This is what you should do, at least for a while. And so, yeah, I made the biology department my home for 8 years. Mostly taught human anatomy and physiology after I convinced my chair that that was the right fit for me. Had a great time there, and eventually took a job at Auburn University teaching human anatomy and physiology to the undergrads, as well as histology. Helped out with kind of capstone course for their pre-professional students as well, and then was offered a position at Lincoln Memorial University teaching veterinary anatomy. So made the jump back into veterinary field, veterinary world, and had to relearn a lot of comparative anatomy that I had forgotten since I taught about humans for 8 years. But it worked, it was a lot of relearning, but it was a lot of fun to marry my two passions of education and veterinary medicine. I think what I left out there was that while I was still teaching full time, I missed clinical practice.
Yeah.
So I did some relief work. That's when I made the switch to small animal. It's because I was able to relieve for the small animal practice in town that I knew the veterinarians there. And then when I had kids, it was hard to do relief. It was every weekend kind of thing. And so I got certified in veterinary acupuncture through medical acupuncture for veterinarians, and scheduled that whenever I had time away from the classroom, just to kind of keep my finger in some aspect of clinical practice, because I missed my clients and my patients and those relationships a little bit too much. But I've moved around quite a bit the last few years and transitioned from my community college to Auburn, to Lincoln Memorial University, and now I'm at the University of Georgia. And I haven't shifted my licenses around to keep up with me, so I haven't practiced in a few years, but you never know what the future may hold. I'm at the University of Georgia now, and I have a different role. I'm in the Office of Academic Affairs, where I'm predominantly involved with rolling out the new curriculum and helping to revise and iteratively improve the courses that have already been launched, and take a role in their professional skills curriculum and coordination of the first year of that. So changes abound in my career path.
I love that. Thanks for
And
sharing.
what
Yeah.
year did you graduate vet school, Cindy?
2010.
2010. Okay, thanks.
It's incredible. There are features of your story that are like, yep, that's pretty, like I fell into, but then other parts of it, I was like, whoo, that's very different.
I
and
usually tell
love
people
it.
my path is not typical.
Yeah. I mean, again, there are
Don't do
features
it the
of
way
it
I
that-
did it.
Yeah, there are features of it that are, but everybody's path has its own, curves and loops and different things. And but I love that eventually you did circle back to veterinary medicine, because yeah, I mean, that's just clearly that was a big passion of yours from the get-go. You don't go to and then get through successfully vet school without like a pretty strong drive, right? Like it takes a fair bit. Some people do, I guess, but it's nice that you sort of made it home, I guess. But with that lens, that way to kind of marry multiple passions together is lovely. But I also appreciate I had to relearn some stuff. That's great.
Yeah, it was quick. It was a quick transition.
That was actually really fun for me too, because I knew some of your story, but I don't think I had known the full, all of the aspects of your story, particularly the clinical part that you missed it and those kinds of things. So that was really fun for me to learn something new. I think one of the things that you and I have in common is that we broke into veterinary education at the university level without being specialty certified. And I'd really like to kind of explore that a little bit more with you, because I know in our own conversations over the last couple of years that that's been a frustration on both of our parts. And so I think maybe just kind of hearing a little bit more about that and how you persevered and sort of how you found your niche would be really helpful to other people who are maybe in a similar situation.
Yeah, it's interesting that you bring that up. I just had a conversation about that today with somebody else. How, depending on where you are in veterinary education, there either is a very strong push for specialists to do practically all of the teaching within a veterinary curriculum, or some of the other vet schools are transitioning to do a little bit more of a divide, where some of the preclinical material is taught by either general practitioners or PhD trained scientists, maybe a mix of the two, and then you get more exposure to your board certified specialists later on in the curriculum. Yeah, it's interesting, because I wonder how much of my perceptions of that are self-imposed and how much of it is real and coming from external sources. In a similar lens, when I first applied to teach college biology, a faculty member in that department that had any postgraduate anatomy training at all. And I applied and the department loved me. This was at the community college. And they loved me and they put my name forward as a recommendation for hire. And the president thought I wasn't qualified. And so the department and the president had some conversations. And then she invited me to come in for a separate second interview with her, one-on-one. And I prepared basically a dossier. And I looked up every school that was SACS accredited, that had a veterinarian that taught in a biology department, and pulled their portfolios and put them all together for her and took it in and said, look, here you go. All of these other SACS schools are accredited and do it. And she thought maybe it was because they had additional credentials they had not published on their bios.
Yeah.
But and anyway, one of the other faculty who'd been there a long time said, well, if she's not qualified, I'm certainly not qualified. I've been here for 25 years, but I've never had any formal postgraduate anatomy training. I guess you should let me go too.
Nice.
And
Nice.
so sometimes I think it takes an advocate, right?
Yeah, that's an ally.
Sometimes I think
Sure.
it takes an advocate. It takes someone else who has a seat at the table to be willing to say, this is something that do. So I think that's a perfect analogy kind of for how it could be as a non-boarded veterinarian in academia.
Yeah.
It depends on where you are, right? What the specific culture is at your institution, whether or not that's something that's widely accepted.
Yeah.
Does that align with your experience, Catherine?
Yes and no. I think for me, I mean, I was not even internship trained, and so I think that was part of it. I do think, I mean, I'm almost very stubborn. I mean, I've said this before, and I was like, well, I mean, you all don't think that I have anything of value, but I feel like I have a lot of value as an educator because I have extensive training and experience in that, and that's basically my specialty area.
Right.
But I think for me, I mean, I was able to break in simply actually because of that, because I had a PhD in education, and Lincoln Memorial was looking for somebody who had those credentials. And at the time that they were looking, I could name 5 people in the veterinary profession who had the credentials I had. And none of them except me applied for the job. So, you know, it was not that they would have taken me if they didn't think it was a good fit, but, you know, they were looking for somebody with those credentials. So I think there are various ways for individuals to get in to veterinary education. I also think that the tides are turning a little bit more. I remember when I graduated in 2008 from Texas A&M, and we had one instructor who did not have specialty training. She was a DVM who had been in general practice, and much like you, Cindy, kind of discovered that she really liked to teach and was able to break in at A&M as a histology professor and did a phenomenal job. But she had no other credentials other than a DVM, which I think is fine, right?
That's pretty good credentials.
I mean, there's too many people out there.
DVM.
Yeah, I mean, there's too many people out there who are like, oh, I'm just a DVM, or I own, you know, it's like, no.
Who do you think we're training?
That's a lot, right?
Like you came in and you said, okay, I'm a DVM and I would like to train cardiologists, right? Somebody who's already got a DVM and I've been doing this for years. No, that's not what you're talking about doing. You're talking about taking people you are the content expert. This is what I try to explain to people. Like you have the DVM, you have the content expertise by definition to teach anybody to so again, the content expertise you have, and then if you have additional expertise in teaching, that's all the better. But like when I don't know, I feel a little bit differently. Yes, I have board certification that did not prepare me to teach veterinary students any better. And I would argue that most specialists struggle with how to figure out what does a DVM need, not what does a resident need. Right. Like, I mean, I've struggled with this myself. Like I have to like self-check, be like, it's resident levels, you know, like I've gotten a lot better at it over the years as I've thought about it. But I don't think having board certification in a specialty necessarily makes me better at teaching even that specialty than someone else.
I mean, I would say from the educational perspective that experts are probably the worst people to be teaching entry level folks, right? Because, and this is one of the, and maybe this is something that you find too, Cindy, especially in your current job, is one of the frustrations and constant battles that I had with faculty when I was in academia was No, you can't put 80 slides into a 50-minute lecture. Like
Right.
you've
No one
got to figure out what you need to cut. Well, but everything's important. No, everything isn't
not.
important.
No, it's-
Everything's important to you, but what you need to determine is what's important to help your students be successful, right? And to your point, Bobby, I mean, quote unquote, only a DVM, there's 115,000 DVMs in the United States out of 330 million people. So having a DVM makes you pretty exceptional in a lot of ways. So yeah,
Absolutely.
I get really frustrated when people say that. And I think that's part of my frustration with, the whole trying to get people into academia who aren't specialty certified. And we absolutely need specialist teaching. Absolutely 100% must have specialist teaching.
Some.
They don't need to be teaching everything.
Yeah.
All.
And again, I still think it needs to be collaborative, right?
Yeah, absolutely.
Because those are the perspectives that are really helpful. So in my specialty, right, like I think it is important to have my perspective, because I do this narrow thing. And so in that very narrow thing, I can be like, here are the priorities, here are the things that are really important, but that can get clouded, right? I've got
Yeah.
my blinders on like everyone else. And so I need somebody from the other end, or from a different perspective, to be like, yeah, no, that's not something, that we are doing over here. So or somebody from large animal giving some perspective to somebody from small animal, like all of
Yeah.
those perspectives are really helpful. Yeah.
Yeah. And
I
definitely
remember there was a time when I remember the students saying in surgery lab, why are there residents here? We need to be being trained by the board certified specialists. And it made me think, I've done martial arts for forever. I've taught martial arts for forever. I'm like, a white belt does not need a 5th-degree black belt to teach them how to do a punch or how to make a fist, right? Like you need maybe a green belt, like a middle rank person who knows more than you can just like get the basic movements into your brain. And I still generally believe that. And I'm 98% in agreement with what you all are saying. But it has occurred to me relatively recently that there are some things that I have seen as an anesthesiologist and as a martial arts instructor that students are getting taught, and I'm like, but they missed a wee bit of nuance because the person who taught them was not actually an expert.
Sure.
And now this student has this sometimes significant, usually slight educational deficiency that I have to identify and correct.
Yeah. Oh, no, I think I agree with that. I think that's why with Bobby saying, we need to be collaborative. That's the thing where it's like,
Yeah.
hey, I can't give you all the nuances of this. I can tell you what I did in practice and why I did it. But if you want to know X, Y, and Z, then, maybe Dr. Hoffmeister or maybe, Dr. Connor needs to be teaching that. So I fully recognize as a GP that there are things that I should not be teaching.
But I would argue
so
back a little bit with that, Eric, is that happens with board certified specialists too. Sorry. I'm just going to say it because I think there are things that change over time, and there are like disagreements between specialties. There are like, so I've experienced exactly what you're saying, and I'm like, oh man, but if you had that that background knowledge of the why behind these things, like, yes, I do think there's a difference there, but I don't know that is always necessarily just a specialist, board certified specialist versus not, because I've seen specialists make those mistakes and I've seen, non-specialists like get it. So
Yeah. And
proportionally,
I
it's
think
probably more likely. I think you're right.
well, but I think in defense of the general statement that we have, which is we should be having educators teaching this instead of content specialists teaching this, I think more errors are made by clinical specialists who are not good educators than people who are good educators but are not content specialists, right?
Yeah.
Like
Yeah.
the
Yeah.
degree is so dramatically one way. Nonetheless, I do think there are some times when I'm like, they missed this because they weren't a content expert.
Yeah, that's totally going to happen.
It's
but
never
yeah.
going to be all or nothing one way or the other. I agree. I see a need for both. And I really appreciate one thing that I got to do at LMU was as a GP who came in teaching a basic science, I taught anatomy, and I had an equine surgeon come in and team teach kind of the culmination of a module with me. And I designed a team-based learning activity and designed a specific question that she, the surgeon, and I deliberately disagreed upon the answer to. And we talked about that in front of students. And it wasn't something where it was a right or a wrong. This was still an unknown. This was before the definitive diagnosis. It could have gone either way, but based on our lenses, our perspectives, and what we had seen in the world, we saw that slightly differently. And I think that was really important for the students to see, because very often our students, maybe more so than other students, think the world has to be black and white.
Mhm.
They have had to get a 99.9% on every assessment, their GPA is a 4.0, it's like a 4.2 or something by the time they get to vet school. It's ridiculous.
Yeah.
And they don't
What's the
understand
right
yet
answer?
they don't know how to deal with uncertainty.
Mhm.
And I think that's one of the biggest places that we fail them. You
Mm.
can give them all of the information you want, but
Mhm.
it doesn't matter if they're not able to integrate it and figure out how to use it practically.
Yeah.
And the practical part of that is when there's uncertainty.
Mhm.
We don't often have a right answer,
Yep.
Yeah.
Yep.
and sometimes you do, but
Yeah.
it doesn't happen very often. And how do you get students to start thinking that way?
Yeah.
I really
So
like script concordance questions for
Me
that, where you
too.
ask that, and what's fascinating to me about script concordance questions is when you ask 20 experts to answer that question, they don't all give the same answer, right? You get a bit of a
Right.
distribution, which is why
Yes.
you're supposed to weight it accordingly. Like, that's wild.
So you're all going to love this. So years ago, this was when I was at Florida, I had a course in like a clinical skills course. And so I took this class and it was veterinary debate day. And I went around to different specialties in the hospital and I said, okay, small animal internal medicine, what's the thing that you as a group do not agree on? Tell me the thing. And then I went to large animal surgery. What's the thing that you as a group, if Dr. A is on, they're going to treat it this way. And tell me all of
That is so cool.
and then I brought those back and here's the list and I assigned them to different groups. And I said, all right, our current internal medicine faculty do not agree about this. Okay. Yeah. So you've been assigned to this argument and you've been assigned to this argument. You need to go find the data to support the argument you have been assigned. This isn't what you believe, but I want you to go argue your case. And so they had a little bit of time to go and research it. You can talk to experts, you can do whatever, but in the debate, your evidence is going to be, what decides who wins this argument. And it was funny, even with that, how many of them came back to the debate was like, well, when I was in practice, like I saw this. And I was like, all right, we'll work on this. The debating, some of them have better skills than that. But the idea that there are things out here that the experts that are all together at this place do not agree on is real. So I had a lot of fun with that. But I was like, I need to make this truly real. I need to go and talk to the people on the different services about what are the things that you all don't currently agree on.
Yeah. I think it's really important, and I love those ideas a lot, is to help students. It's not about getting the right answer, it's about justifying the answer that you come to, right? Because there are lots of different ways to get to the answers, and sometimes you're going to get it right and sometimes you're going to get it wrong. But at least if you can, in your brain, justify that, then you're probably going to be okay.
And also recognize that the information you need to use is gonna change, right? And it should, and you need to be ready to learn how to change with it. Because if you say, okay, well, I learned that in vet school, and you're like, well, that was 20 years ago. We have a lot more information now. Like that argument isn't gonna fly. Like you have to move along with the rest of us. And so trying to like teach them those skills and those concepts, because you're right, Cindy, when they get into school, they're like, but okay, that's all fine, but what's the answer? You're like, no, that's not the answer. Is there isn't one. So
coming back to that, there's a question here that I'm curious about for you, Cindy. Is you were at LMU for several years teaching anatomy. You've had a lot of experience in education, and you're now in a position where you're supposed to be teaching faculty. And so I'm curious about what your current education challenges are.
You already voiced it.
What, the teaching the faculty part? Never.
The adjustment, we'll leave it at that. The adjustment, right, to teaching faculty. Fortunately, I've been in higher ed for a while, so I've had plenty of opportunities for professional development. I started doing the Master's of Veterinary Education through LMU. I'm about 3/4 of the way through that now, and I have already started treating my students like adults before I moved and started teaching or helping educate other adults. So it's not as big of a shift for me as it would be for some others. One of the most important things that I've always felt about my role as an educator, particularly once I got to the vet school level, is having relationships with my students, forming relationships with my students, where they feel like they trust me. And that doesn't mean I always have the right answer, but they trust me to be honest with them and be able to provide feedback and receive feedback from them. So that transitions quite well, I think, into working with peers. It's not an easy transition per se, but so far I think it's going pretty well. I started in January, so it's about half a year under my belt now. I've gotten to see half of the first year of the new curriculum rollout, and my big role has been to teams as their courses end and reflect and think about what we might want to do differently next time. So some of the same skills apply, but it's definitely an adjustment. And I do miss the time with, quote, my students.
Yeah.
You know, I miss having my course where I'm the master of my universe, right?
Yeah.
And I can create the things that I want and implement them. It's a different type of experience for sure, but I am still going to teach professional skills in the fall. So I think that will give me some of the positive feedback that I am used to getting teaching student populations and having my own course. I don't have a particular challenging situation that has occurred. It's just a shift.
Yeah.
Right. It's a shift in the way that I have to think about approaching mentorship and education.
Yeah. That's good. Yeah, I think I agree with you. Having been in just coming out of an administrative role, one of the things that was really tough for me was not having the opportunity to have that connection with students, really. I mean, I had occasional opportunities to do that on an individual level, but, you know, just being able to get to know the class, getting to know their personalities, sort of like, you know, one-on-one and sort of figuring out who I could really connect with. And that, I think if I had been anchored a little bit more in that, I would have lasted a little bit longer. Because that's really kind of what fills my cup, right? Like as educators, that's the stuff, that's the good stuff.
Yeah.
And if you don't get enough of that, it doesn't really do much good for you.
That's why we all got here, right?
Yeah, yeah, exactly. So
I don't really know why I'm here, to be honest.
it's so you can fund those trips to walk across Spain that you then bail.
Right. That's right.
That's fair. Cindy, something that you mentioned really struck me was the concept of trust and how important that is for pretty much any human endeavor. And this is something I've only really recently kind of discovered for myself, even though I'm a grown-ass man. And I realized that a lot of the things that I've been involved in that have failed because I'm like, this is self-evidently good. Look at the data. Realize that it is self-evidently good and do the right effing thing.
Right.
And people are like, no, I'm a smart monkey. I don't trust you. And I'm like, but look at the data. And
yeah.
Yeah.
And I agree with that actually. And it's hard for me because I am very, very, very analytical. And so I really want to be like, look at all of these publications. I can show you this, and this, and this. But that doesn't tend to win arguments very well.
It might win an official debate, but it's not going to change anyone's mind.
You know what's really interesting to me, though, is that all of us are scientists, right? We're all veterinarians, so we're all involved in science in some way, form, or fashion. Maybe we don't call ourselves scientists, but we have science background and science training. And as science background and science trained individuals, we are taught that you look to the evidence, right? And so that's kind of what we tend to do. And I will say that when I was teaching public health, it was very clear to me that what won arguments was not data, it was emotion. So if you, I mean, you know, not to bring up politics, but if you look at what Donald Trump did, he played to emotion, really strong emotion. And that is part of the reason that he won. And so I use that as sort of, you know, a conversation point with a lot of my Masters of Public Health students, because they would do the same thing. They'd be like, no, But I give them the data. I show them the information.
We
I give
actually
them the
have data
statistics.
that says data doesn't change people's
Right,
minds. There are
exactly. And
scientific
they're like,
studies that
but
say
my
you
my
have to tell a
aunt,
story. You have to,
yeah, my aunt, my uncle, my sister, my brother still doesn't believe me. And I'm like, okay, well,
that's what
why?
science says.
Well, but because you need to appeal to their emotions. You
Yeah,
have
because
to tell
all of
people,
those scientists, us included, we're people first.
right?
And I love this. We're not thinking beings who sometimes feel. We're
No,
feeling beings who sometimes
right.
think.
And the thing that's so interesting about that is that because we're in a community of scientists, and I'm going to put scientists in quotations, when we talk to people about education, educational principles, educational theory, and the value that that brings to us in the classroom, and we present them with that data, because they always say, well, show me the data, show me the data. And then we show them the data, they just look at you and say, well, that can't possibly be right. I've been doing this for 30 years and I know that it's not
Exactly.
right, you know? And
Because
so
I
it's just
feel like what I've been doing for 30 years. Well,
exactly.
there's another part to that, right? Like there's like almost a grieving process. If you've been doing something for 30 years and then you find that actually it's not supported by the data, like that's a thing you've got to process. Right. Like, and how do you do that and say, hey, what I've been doing for 30 years has been wrong?
Yeah.
And again, we don't necessarily want to put it in the terms of right or
No.
wrong. Like, hey, what you've been doing has been working, but could this work a little bit better? But that's not how it feels, right? It feels like I'm being attacked for what I've been doing for 30 years and I've been promoted and I've done all these things. And you're going to come along and tell me with your scientific blah, 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 your social science, which isn't real, like that's a defense mechanism because that's how it feels. I feel like my whole career is being attacked, but yeah,
Bobby,
yeah.
tell me again how that feels since we're going through the curriculum revision, changing things that you've been doing for a long time.
True.
Yeah.
True.
Yeah. No, it is true. And so I think, and I agree with you, Eric, and I definitely agree with you, Cindy. It's, when I was doing my mentorship with individual faculty members, one of the things that I would tell them is you've got to create a safe environment. You've got to create a place where students can feel and can express things that maybe you don't agree with or maybe are wrong, and you have to do it in a way that's compassionate but it's challenging at the same time. And I think that's something that a lot of instructors don't learn until sometimes it's too late, and then they figure it out, and they sit there and sort of lament the fact that they've ruined the lives of several classes of students, even though they haven't, but they still feel like that because we're all very hard on ourselves. So yeah, I think you hit the nail on the head with that. They've got to trust you, because if they don't trust you, they're definitely not going to learn as well.
The other thing that we tend to do, which undersells our students and their capabilities, is think that we have to give them all the information, right? That's the other thing that we tend to do. It's that 80 slide PowerPoint you were talking about.
Yeah.
And there's no way that we can give them all the information. So not only do we have to create a trusting environment where they trust us, but we have to trust them to be smart enough humans to be able to use their brains that we're training them how to use. That's what we should be doing. Training them how to use their brains, not how to regurgitate
not how to memorize a list of differentials.
Right.
Yeah. That's not going to serve them at all out in practice.
Which we can do if we aren't trying to cram 80 slides into a 50-minute hour.
I want you to think. No, I love it.
If we give them 20 to 25 slides in that same 50-minute hour, then they can actually process information and come up with really good questions.
They might actually learn something instead of being taught at.
And they might actually retain some of it, right? They might actually retain some of it later. I mean, I can't tell you how many times as a student and as an instructor, I've talked to students that are like, oh no, I don't remember that. That was last week and I've already been taking a test on it. Why, why would I waste brain space?
Oh no. Yeah, I crammed that for the exam. No, it's
true. Exactly.
Cindy, I want to circle back to something you mentioned earlier in the show, when you were talking about the being a non-board certified, like not a board certified specialist in a discipline, but having the education background. And you mentioned, how much of that is like internal from me and how much of that is external. And I'm curious because I've had this same question because I've got on my service here, I've got 4 faculty members who are not board certified in emergency medicine. And I try to work really hard to ensure that like you are faculty. It's not faculty with an asterisk, you're faculty. And I want you to behave like that, and I want you to be treated like that, and I want to make sure I'm treating you that way and others are. And and it's something like I've sort of struggled with that, because my observations is that sometimes that is coming internal, right? I want to empower them, be like, you are faculty, like that. There isn't a, you know, a hierarchy amongst the faculty, even if it's like associate assistant, like I don't even care about that. Like, you're all faculty.
Right.
I'm curious if you could speak a little bit more to how you, and Catherine, you as well, like how you have felt, and how much of that you think is like internalized, and how much of it is, I know it's both, right? But like, yeah, if you could speak more to that, I'd be curious.
That's a loaded question.
I know.
So, someone who I consider a friend, told me when I was going to interview for my job to teach undergrad at Auburn University, they are never going to hire you for that. This is a veterinarian, a friend who is a veterinarian. They are never going to hire you for that. You are just a veterinarian. You are not qualified. Catherine, if they could see your expressions right now. So, I mean, to my face,
Yeah.
right? And it wasn't that long ago. I went to Auburn in 2018. So it might have been 2017. I mean, it wasn't like it was 25 years ago that this was said to me.
And this was a veterinarian, like, dude.
This was a veterinarian who I knew well.
Yeah.
And I still consider a friend, like, truly. Just, we didn't
Are they a
talk about that
specialist,
anymore.
or do they have board certification?
No.
Okay.
No. And so it's a little tangential to your
Yeah.
immediate question, but it plays into, because it helped plant a seed, right? And these comments that get thrown around, oh, you're just a veterinarian, you hear them whether or not they have malintent, or we need more specialists teaching students because we don't know if they're going to get it right otherwise, right? You hear these comments and they start to become part of your psyche, and so you do internalize it. Now, it is my perception now due to my internal bias, or is it due to something external? I can't say fully, because it's impossible for me to separate them, right? But I've had enough of those comments said directly to me or in my presence that I know that that's still a perception that's out there.
Yeah.
I think that the two things that really make a difference, one, if you have somebody who advocates for you, right? Like, you have somebody who's already there, who's already quote unquote made it, who's willing to stand up and say, no, she's great at this.
Yeah.
She's got it. And you have to be able to step out on that limb yourself too. So I can't remember what it was, but recently I saw something on social media, and it was unrelated to medicine, but it was about stepping forward in a scary situation, stepping into the scary. And I shared it, and I like put a post on social media, like, to all of my students, this is who you have to become, right? This is how you are going to become the veterinarian you want to be. You have to step into those situations that you find a little scary. You want to prepare yourself for them, but when it gets there, you can't step back.
Yeah.
So I think those are the two things for me that really help get through some of the internal and external bias that may exist.
I think one of those, the word just, that
Yeah.
I'm just this, or you're just a veterinarian. I'm like, such a big deal.
Yeah, but I think to speak to that, one of the things that I have come to realize over my time is that when you're raised in an environment like academic veterinary medicine, which every veterinary student has to go through, the people that they come in contact with are not just DVMs. They're DVM PhDs, they're DVM and diplomats, they're DVM MS, they're whatever, right? DVM MPH. There's all of these letters and alphabet soups that are going around. And so when students graduate, because I know when I graduated, and I was 35 when I graduated, I was like, man, everybody and their mother must be a DVM PhD or a DVM, specialist. And then you realize, well, actually, only 12% of the veterinary population has a specialty board certification, and that only about 20% of people actually go through residencies, and that probably 10 to 15% of veterinarians have an additional, advanced degree. And then you start to realize that that's the exception when you're going through college and going through your veterinary program. It's not the rule. But we don't teach them that explicitly when they're going through, and we don't emphasize that. And I think that's one of the advantages of having people who are DVMs and that are GPs in schools saying to people, listen, I'm a DVM, I'm a GP, I'm very important. I have a lot of information I can relay to you. If you want more advanced, more in-depth information, then absolutely, here are some people you can go to. So I think it's really good that we are starting to model that for our students. And so they don't feel already when they graduate that somehow they're inferior to all these other people in the field because they're just a DVM, right? Because that's the backbone of
approach it even a little differently from that. So one thing, whenever I hear a student, like when they're talking about like, what are you going to do after graduation? Well, I'm just going to go into private practice. Like,
right.
No, you're going to private practice. And there, in a lot of ways, that's harder than what I'm doing. Right.
Yeah.
So I use this refrain a lot with students. I'm like, you have a very warped perception of what you should know, because when you go on to ophthalmology, you're working with people who only do ophthalmology. And so they know ophthalmology really well, but ask them about cardiology. Like, you notice they're not even wearing stethoscopes, right? Like, ophthalmology. So they're really good at ophthalmology, and they're asking you ophthalmology questions. They're not asking you about, the equine gut. Like, they don't care. They don't know. They don't remember. They have the privilege of forgetting so much stuff. Right. Yeah. And so I remind them, when you come onto my service, like, I'm doing this wedge over here, and don't ask me about preventive care. Don't ask me what vaccines are. I don't know. I don't know. You actually know more about that than I do. Being a good generalist is so much harder than specializing. Specializing, in a lot of ways, I think, is giving yourself permission to forget a lot of stuff and to say, like, oh yeah, I'll go down the hall and talk to somebody else because I don't do that. And that's what specialists do.
Seriously, they do.
No.
Like, yeah, not me. Yep. Next. Nope. Can't do this. Is a good transfer for me. This isn't what we do. Like, they're like, I forgot how to vet. I don't know how to do it anymore. I'm like, okay, I think you can probably go back and remember. So I try to provide that perspective that when each service you're rotating through, you're working with somebody who only does that. And then you do that for 2 or 3 weeks, and then you go on to a very different one, and they're going to be a little kinder to yourself. And recognize the challenge of doing all of it. That's way harder in a lot of ways. And so, I don't know.
I think I love that. And I also think that, I use this as a good example sometimes, because I think students forget the vast quantity of information they're asked to digest and actually, in some cases, regurgitate, and in other places really apply. And so, I've had conversations. When I was teaching public health, I was sitting next to my dean, my first dean at one point, and we were talking about our certificate that we wanted to launch. And he asked me, what the audience was going to be. I was like, well, we get veterinarians and we get, public health practitioners. And he's like, I've always been curious about something. And I'm like, okay. He's like, what do people who try to get into vet school do if they don't get into vet school? And I looked at him and I said, they go to medical school. And he said, and he looked at me and he was like, really? I was like, yeah. He's like, oh, you're serious? I'm like, yeah, I'm serious. And so I remind people, because there's just this like, oh, well, physicians are this and physicians are that. And when I was doing, fast forward, when I was doing one of my externships at White Oak Conservation Center, which is, it's a private, very expensive place where they basically try to save endangered species, right? And we were getting ready to go do rhino work. And so we had a bottle of guaifenesin on the table because we were going to help use that as part of the anesthetic protocol. And so it was sitting on the table, and they happened to have some Harvard trained physicians who had come through because they were getting a tour of the facility. And one of the women, I'll never forget, she's wearing these like high heels.
I know where this story is going.
Right. So she's wearing these high heels, and she's got this cute little skirt on, and she's like getting ready to go out and see all the cute animals. And she walks in and she looks and she starts laughing. And I'm sitting there as a 4th year vet student, right? And she starts laughing. She's like, oh, what are you doing without guaifenesin? You got an animal with a cough? And I just looked at her and I said, no, actually it has sedative properties, and we're using it as part of our anesthetic protocol because rhinos are sensitive to it, and it really helps kind of smooth the anesthesia out. And she looked at me with this look on her face, like, and I almost started laughing because it was almost like she couldn't believe that she didn't know this, and she was embarrassed, but she also didn't want to show that she was, and it's like, we know a lot as veterinarians, we know a lot. And as general practitioners, we know a lot. And I think people sometimes don't give us enough credit for the things that we know. And so, I tell students that story a lot too, because they're like, oh, Harvard trained physician, they must be really smart. Yeah, they're really smart, but guess what?
They're
We're
narrow.
smart too.
That's how you get to be an expert. You get really, really good at like a very few number of things, right? And like that's how it works. And the more narrow you get, the better at that one thing you can be. But that, yeah. Anyway.
While you were talking about students rotating through these different specialty services, it made me think of a question. I don't think anyone has looked into this. There's not been a lot of research yet on distributive versus traditional clinical year in veterinary medicine, but now I wonder, does a traditional clinical year in a teaching hospital contribute to imposter syndrome and potentially affect students' well-being the first year or 3 years after graduation?
Yeah, that's a great question.
Not asking about their competence, just asking about, does it affect their perception of themselves?
Yeah.
Interesting.
Absolutely.
And to compare it to like a distributed model where they're
Right.
working with general practitioners who maybe are modeling more the career path that the majority of them are going to take.
Maybe.
Right.
Maybe.
And they don't feel like just a veterinarian if they're surrounded by.
Yeah, they're learning from these
veterinarians.
experts who are out in the field doing the
Yeah.
work. Yeah, that's an interesting question.
I don't know. There's a lot of things that I wonder about distributive versus traditional.
There are so many research questions. I remember reading a book in human medicine about, because a lot of human medicine is distributive, and like every page I'm like, we don't know that, we don't know that, we don't know that. Like it's shocking. So much
What's
research.
weird, I think, in human medicine though, is most med schools are 100% distributive.
Yeah.
But then there's like the 2 med schools in each state that are like the stalwart med schools that aren't distributive at all.
Yeah.
They're entirely teaching hospital focused.
Yeah.
And I've not seen anyone really dive that much into that either. Have you?
Well, I mean, I can tell you that I touched on that a little bit in some of my earlier research, just because of the conversations that were going around. And I mean, it all goes back to the Flexner report, right? Which has had as many negative impacts on medicine and veterinary medicine as it has had positive impacts. But I don't know that anybody's explicitly looked into that specific question, either in human medicine or veterinary medicine, sort of that.
I've not seen that.
Yeah, I think it would be really interesting. I will say that I think there are a couple of things in veterinary medicine that would be difficult to tease out from that. I think you could probably explore that at some level, but there's all of these sort of
messy
confounders, right? Part of that is the fact that it's a primarily female-driven profession. I'm reading a book right now about sort of confidence and the things that women need to know about confidence, because there's some biological factors, there's some social factors, there's some things, the way that our brains work are a little bit different. And I think about that in relation to veterinary medicine because it is so highly feminized at this point. And so I think that has a lot to do with that imposter syndrome, but maybe it is exacerbated by being in a specific type of training program and being surrounded by specific types of people. I don't know. I think it's a great question.
It is. I think it'll be difficult to tease that out in if you looked at human medicine though, because you have to remember in human medicine, they're not done after med school, right?
Yeah.
Like all going on to do additional training. So so I don't know that you'd be able to make that direct comparison, because being around people who are like in a specialty, it's like, well, they're all going to go on and choose their specialty. So I don't know that you would have that same feeling. Now, maybe there is, maybe it's like, oh, you're just going into family medicine or you're just going to be an OBGYN. I don't know. I'd like, oh, how come you didn't want to be I don't know. But I do think it would be different than what we're going to see in vet med.
Yeah,
I think that's one of the, and we could probably do a whole nother episode on this, is one of the sort of really important reasons that veterinary medicine and veterinary education needs to do its own research, right?
Yep.
Not to say that we haven't benefited from some of the information that we've gotten from human medicine, but I think there's too much of a reliance on what they have found in human medicine and trying to translate that into veterinary medicine. And I've talked to people and they're like, well, I don't know why you think veterinary medicine is so different. I mean, dentists have to be able to practice the day they graduate. And I'm like, yeah, but they're all they do is teeth. And I'm not here to say that teeth aren't important and that they're not difficult, but that's all they do, right? Like we do teeth, but we also do skin and we do internal medicine and we do surgery and we do dermatology, you know, like all of these things. And so there's just all these arguments, and I struggle with people who don't understand and appreciate that veterinary education is its own discipline and it needs to have its own research that can sort of extrapolate some things and maybe use that as the basis for what we sort of explore. But it's going to be different for us. We have different expectations and a different demographic and all those kinds of things. So, but again, that's
even dentists, if they want to go and do oral surgery, they have to get more training.
Exactly.
Like veterinarian, you're like, oh yeah, today you're going to do 3 surgeries and then you're going to do some internal medicine and then you're going to go out in the field, and because you're in mixed animal practice, so now you're also going to go out. Like, yeah, and that's all expected.
And even as a small animal GP, I mean, I don't know any family medicine physicians who have amputated limbs and, you know, done splenectomies.
Maybe if they were in the military.
Right. Have done resections and anastomoses and have done cystotomies and have done, you know, I don't know any of them that have done that. I have done all of that, and most GPs have done all of that. So it's fascinating to me that people don't want to recognize that veterinarians really do a lot.
I do think talking about things like that matter. So I still remember when I was in vet school and I was on my cardiology rotation with George Eister, who was like, you know, big deal in cardiology at the time. And he was talking with us on clinics. I think he had just like done a consult with a general practitioner who'd asked about, you know, how to manage something, you know, cardiology related. And he gave us this speech about like how hard it is to be a general practitioner, and that the privilege he had of just doing cardiology, and that this person, you know, was wanting to refer this case, I think, or something like that. But the owner was like, yeah, I can't do it. I can't afford it. I don't want to for whatever reason. So like they're doing their best to be a cardiologist at the same time that they're being a surgeon, that they're being an internist, that they're being a you know, preventive medicine specialist. And like him telling us that and giving us that perspective, I still remember that. Like that was a really powerful thing. I hadn't decided at that time, I don't think, that I was going to go on and do an internship or residency. But I just remember feeling like that was really cool. Like that was a very respectful thing, and it gave me a different perspective. And I still think about that. I was like, yeah, you're right. It is really hard to go and do all those things because, you know, you get the referral, like, you know, people are like, yeah, I just do this. Oh, this isn't for me. This goes to someone else. Well, GPs don't have that luxury all the time. They can make those recommendations, but like, yeah, do your best, doc. And so you do.
Yeah.
And that's really hard. So anyway,
for sure.
Telling those stories, I think, really can be impactful.
Yeah. Yeah, absolutely. Well, we are getting towards the end of our time, Cindy. So I'm going to go around and see if Eric and Bobby have any last questions. And then after they're done, or if they don't have any questions, I'm going to punt it to you, Cindy, to give us any last thoughts you might have for us. So Eric, do you have any other questions for Cindy?
I guess coming into the curricular revision, like this is a thing that had already been decided, right? And they're rolling out, and now you're coming in and trying to make it happen. Just like, I'm sure you could go on for hours about this. Can you just give us a snippet of what that experience is like?
Absolutely frustrating.
That was easy.
So I love it because it's what I wanted to do, right? It's why I took this job. I really, really, really want to be involved with curriculum, big picture curriculum. How do we teach vet students to be veterinarians? I care deeply about that. But having it already kind of mapped out, at least at the bird's eye view, and having to implement a plan that I wasn't a part of is a challenge. I keep seeing things that, oh, well, do we consider this? Have we had this conversation? And I don't have all that background information to be able to build off of. So I'm constantly saying, oh, so I don't have the context here, but did we talk about X, Y, Z? Or has anybody considered this? Whatever it is, you know? So it's challenging because I want to be able to do the big changes that I want to do, and they've all already been kind of.
Oh, I can imagine there's not appetite for like, well, I changed a bunch of stuff.
No,
I can only imagine how that would go over.
Let's just form the collegial relationship first.
Fair.
But fun too, because I get a chance to see behind the scenes, right? How does this actually happen? How is the curriculum that I was a part of, how was it ever created? I don't have a clue. So seeing behind the scenes, behind the curtain, if you will, has been kind of fun, but also really frustrating because I don't have the ability to do all the things that I want to do. Partly because I'm just one small part of the process, but also because I came in, you know, halfway through the first year of the rollout when the first year was practically done and the second year was well on its way. So pros and cons, I suppose.
Yeah.
Yeah.
That's got to be so tough, but kudos to you for recognizing that and coming in and saying, look, you know, I'm here at this stage and I'm going to do the best I can with this. But because I think about that, like, you know, we're in the midst of a curriculum review and we're coming up with proposals for what we want to change. And I can only imagine if somebody comes in and be like, hey, love all that work you did. We're not doing any of that.
Yeah.
I'd be like, are you? So, okay.
That's not a good way to form
right?
big
So I am
relationships.
sure there are people who were nervous about that, but are like very appreciative that you are respecting the process that they had. But I'd be like, oh my God, that'd be maddening. Cause I'd be the person who would want to come in and be like, nope, nope, nope.
Yeah,
But you can't. And I think that's great that you recognize that.
definitely. Bobby, do you have any?
Oh, I could ask lots and lots and we can go for hours more. So I'll stop.
Okay. Cindy, do you have anything last words of wisdom? Anything you want to ask us? Anything you want to bring up before we head off into the sunset?
Nothing particularly, except I wanted an opportunity to say how grateful I am. Oh my gosh, I'm gonna cry.
Oh,
That's like an immediate emotional reaction. But how grateful I am to be part of this community and to have gotten to form the relationships with the people that I have, both colleagues and students.
yeah.
I mean, there's some amazing people in our little veterinary world, and I just feel really fortunate.
Well, we're lucky to have you back.
Yeah,
Thanks.
absolutely. Absolutely. I love that. I think that's a great note to end on. So thank you for joining us tonight. For me, it's been a real pleasure. I've known you for several years now, but I've learned some new things about you and I appreciate you being willing to share that. And I'm excited to see how things continue to evolve at UGA. And in the interest of full disclosure, I was one of Cindy's references for that job. And I was so glad when they hired her because I feel like she was absolutely the right person for the job. So I'm super proud of you and super excited for you.
Thank you. You were one of the people I was referring to that I was so grateful, so grateful to have had a chance to get to know. So thank you.
Likewise. So thanks for joining us tonight. Well,
It was
have you
fun.
back.
Thanks.
Take care.